Good morning, ladies and gentlemen. This is Dr. Bangaru Girish. I'm a interventional cardiologist practicing in Bangalore, and today I'm here to talk to you about the boiling problem that is happening today in the world. That's about the coronavirus, the COVID-19. I'm sure everyone is very apprehensive about this and very is scared about this and panicking about this thing. And you might have got really bored by this quarantine, remaining at house for more than a month now. And of course, I know you all are actually in this competitive world are used to working from morning till night every day, but suddenly you're free and you have a lot of time for the family, you have a lot of time for yourself, and you're not doing anything. If you're working from home, if you're not working from home, and suddenly I know it's a totally different schedule for you and you're not able to take it. And you can't go out of the house because the police will catch you. You're not remaining inside the house because you're bored. So the entire reason why I'm talking to you today is to help you in this difficult situation to understand about this coronavirus and how it's going to affect the entire system, and who are the people who are going to get affected, who are the people who are not going to get affected, how bad is the situation. So overall, to start about this coronavirus, there were a lot of sporadic cases that were defined initially also about this coronavirus. I had read a few articles about this in Russia, a few articles in the US, few articles in the Europe, that there was an outbreak of coronavirus and some people were really sick and some had died as well. But the present coronavirus is called as a novel coronavirus, something new. Novel means something new which we don't know. What is it we don't know here? Because this coronavirus is behaving in a very aggressive way. So that's the reason why it was named as novel coronavirus, because it is not how it was behaving previously. So it was known as a novel coronavirus. But now, how did the thing start? See, the first case of this coronavirus was reported in a province in China called as Wuhan, where on 18th December 2019, a case presented at the hospital, which behaved like a seasonal flu, but it became very bad. In a matter of 20 days, around 29th, sorry, around 28th of January 28th of December 2019, there were only 5 cases and 1 death, and this case was spreading very fast. By about the 2nd Jan 2020, there were about 50 cases. By about 22nd Jan, there were around 500 cases. But 30 Jan, there were around 2,000 cases that report all over China, and about 90 cases that were reported already abroad in all the other countries. It has spread so fast. So the entire thing is, why is this coronavirus behaving like this? Why is it behaving? Why is it spreading so fast? And the thing is, it is causing a very bad pneumonia in few patients, not in everyone. There are patients who recovered well, the patients who came out well, and I'll tell you the percentage of patients who recovered well. But a few patients were really behaving very bad. They developed very bad pneumonia and they succumbed to this pneumonia. So let us see what happens. How did it start? This was presumed to be of a zoonotic origin, in the sense, initially when they found this coronavirus, they found this virus was similar to a virus that was causing seasonal flu in bats. So that was called as a SARS-CoV virus, or it was called as a MERS-CoV virus. SARS is a virus that was causing flu in birds, especially in the bats. And when they found the genetic sequence of this virus causing flu in bats was 88% similar to the genetic sequence of this COVID virus in humans. So they presumed it to be of zoonotic origin, especially it was found in a market in Wuhan where they're trading all the wet animal meat and all those things. And finally, then they started thinking, is there an intermediate host? In a sense, intermediate host where it's going to live for some time and then get transmitted. They found snakes to be an intermediate host. But there was definitely no much evidence to say that snakes were intermediate host in which it was thriving, but it got transmitted to humans, and humans were feeding on these meat and all those things, and probably that was the route of transmission to human virus. But how is it spreading from humans to humans? This is a very interesting thing. See what happens when a person is, this virus usually causes a respiratory infection. Mainly, it causes an upper. See, we initially thought it caused an upper respiratory tract infection. In the sense, it causes a tract infection from above the throat, that is the nose and throat and all those things, and causes sneezing and all. But that's why it was named as a seasonal flu initially when it came, and they thought it behaves like influenza virus, which causes seasonal flu. But gradually they saw that this spreads to the lower respiratory tract infection, lower respiratory tract, that is from the trachea and the lungs, and it causes pneumonia. And when a person who's infected with this coughs or sneezes, see, he produces a lot of sputum and aerosol that comes out. See, when a man coughs, he exhales at a very high speed. So what happens? Many of these droplets, which are heavy, they settle down on the ground. But there are instances where that will get transformed to a small aerosols, which are less than a size of microns, and they'll be floating in the air. Especially this happens when you are in a closed atmosphere. Let us say in a closed office, or let us say in a closed hospital, or in a closed clinic, or in a closed, let's say, a school, or some atmosphere, closed atmosphere. It goes to float in the air for almost 4 hours. So that is how you get infected from these aerosols. But what happens? That is one mode. Second mode is, see, let us say this aerosol was spread in atmosphere, let us say in open sun. So what happens? Because of the humidity as well as sun rays, it kills this aerosol very quickly, and you are safe in open atmosphere, especially when it is sunny. But what happens in a closed atmosphere? See, when you sneeze or cough, you have this sputum particles and this cough material that is settling on, say, let us say, stools or chairs, and let us say on tables and doorknobs and all that. When you touch that, okay, so you and touch yourself, whether we say eyes, nose, or anything, your nose, through the mucous membrane, it starts getting into your nasal cavity as well as the oral cavity, and start settling down in the posterior aspect of the nose. That is the end of the nose towards the beginning of the throat. That is the place where it usually settles down and starts growing slowly. So there were some instances where people were telling that if we gargle nose and throat with salt water, lukewarm, and with salt and some, in India they say some turmeric and all those things, if you use, there was a possibility that we can clear off these viruses at the throat. But actually there is no evidence on all these things, and yeah, we can try, but there is no evidence to prove that it's going to prevent you from getting the infections. So what they said was, if you take a swab from this part of the nose and the throat, and you send for analysis, you can find the viral particles in the swab. But they found this swab was giving only 60% of the information. 60% of the cases, not 60. It used to be positive only in 60% of the cases, but not 100% of the cases. So 100% of the cases were positive only if you take a swab from the trachea, that is from the windpipe. So what happens? Is it practically impossible to take swab from an alert fellow who has just got the infection? Okay, so now I'll tell about this analysis a little later. So now what happens? That is how the infection gets transmitted to a person. But there were cases where these viruses was causing upper respiratory tract infection. In the sense, it was causing cough, it was causing sneezing, it was causing temperature, it was causing generalized weakness. What about some other rare symptoms, like there was causing hemoptysis, that's blood in the sputum, and some cases it was causing diarrhea. So because of diarrhea, so when what happens in if a proper hygienic situation is not maintained, if a patient passes motions or stools in a closed in an open atmosphere where a person gets contracted by stepping on that or something, is another route of transmission, which is being proposed, which is very less, but it isn't proposed, but it is there. So that is the reason it's always better not to get out of the house. And See, that is how. And when you step on these things, and you touch that, and without knowing, you touch your eyes, nose, and everything, it might get transferred 1 second to your throat. That's how it's spreading. It's also proposed postulate, but the chance of this is very less. But it is there. We have to keep all these things in mind. And so what happens? What happens when, let us, that is how it's spreading. I told you about spreading. So what happens after it spreads? This coronavirus, as is being depicted in all the pictures around, they have some tactical sort of things. They're called as receptors. These receptors, they get attached to the receptors in the lung. They're called angiotensin converting enzyme 2 receptors. They get attached to these receptors and they get internalized. They get inside the mucous membrane of the lungs. And what happens? The viral particle that will be having all this, the viral DNA, all those things will get incorporated into the DNA of our cells, and that's how the disease process starts beginning. That's starts. So now, what is the next step? What happens? See, of all the people who are infected with coronavirus, it doesn't mean that everyone is going to die. So what the latency of this virus is around 4 days to 10 days. In 10 days, a patient might, or even some studies say it's up to 14 days. So up to 14 days, a person can be asymptomatic, or he can suddenly develop a fever, or develop suddenly respiratory symptoms like breathing difficulty or cough and all this. That is the latency of the virus. So that is the reason why we have defined a quarantine of 14 days. So what happened? So within 14 days, this internalization of the virus, then the incorporation of the DNA into the DNA of humans and all these things, then patient throwing an immune response, all these things should happen. So once this 14 days is over, almost 85% of the patients, they through mild symptoms, in the sense they might develop a simple upper respiratory tract infection, simple fever, simple weakness that will settle down. These are called mild symptoms. Some people develop severe symptoms, in the sense they start develop, that is, severe symptoms is the second set of groups which are severe. They develop severe cough, severe breathing difficulty, requiring oxygen support. Okay, and they might get secondarily infected by bacteria, so they will develop frank pneumonia. Okay, they might require a hospitalization, they might require an ICU bed, and there a doctor will be required to give him respiratory support, for example, a non-invasive respiratory support or a simple oxygen, give him antibiotics to prevent him from going into secondary bacterial infection, or if he's developed a secondary bacterial infection, give him antibiotics to treat that, give him some antibiotic medications to kill all these viruses and all these things. And what a doctor can do is just kill the virus, kill the bacteria. And what happens during this infection, a patient might develop drop in the pressure, so that organ perfusions will be drop in the blood pressure, so that the organs will not get its blood supply, whether it be brain or kidney and all those things. So doctor, what can you do is you can just kill the virus, you can kill the bacteria, it can give you support to increase the blood pressure so that all the organ function is maintained. But the body itself has to put up an immune response, fight against the disease and come out and treat. So it will take some time. This is, and this forms of this category of patients are around say 10 to 15% of the patients who come out. But another 5%, which is the most critical part of the disease, and they're called critically ill patients. These critically ill patients, they require ventilator support, they require aggressive inotropic support to prevent them from going into collapse, because circulatory, going into sepsis, and they develop circulatory collapse. They develop hypoperfusion of the organs, whether it be kidney, that is reduced perfusion of the organs, whether it's kidney, brain, and all the vital organs, where he might develop in a kidney failure, develop brain failure, and all these things. And these are the people who are very critically ill that require aggressive therapy. I'll tell about all this therapies a little later. So what happens in such critical patients? So since the lung is involved in this, okay, the neighboring organ is the heart, so that the infection can spread to heart. That causes something called pericarditis. Pericardium is a layer that covers the heart. That might get infected. From there, it can spread to the muscles of the heart. It can cause myocarditis. And when these things develop, patients become very, very critical. They require steroid therapies. They require aggressive supports, in the sense I might remember something called as an ECMO support or something called as life supports and all these things coming to it. I'll tell about all this in little detail a little later. So what happens? This is how the things spread. These are all things that can happen, but this happens only in 5 to 7% of the patients who are critically ill. Okay, so they are the patients. So the entire government and we and everyone, we are scared that you people can go into this 5% of the 5 to 7% of the patients, and you might become critically ill, where you require a lot of support, whether it be medical support, whether it be additional device supports, or whether it be ICU supports, or respiratory supports, and all those things. And these patients, they don't thrive well. Only some 10% of the patients like this might come out of the situation. So these patients succumb to coronavirus, and we don't want you to go into this 5 to 7%, and that is the reason why government is stressing so much about you to stay at home and not to get infected with this virus. So let us say, so now this is this is how the clinical scenario. So I told about how this is going to spread to everyone, and this is going how it's going to cause disease, and how it's going to cause multi-organ failure, and how the patient is going to succumb to this particular virus. So next, so what are the treatment options? See, how do we prevent this first? So let us come to prevent at last. What are the treatment options available here? See, always they say prevention is the best treatment. So preventing you from getting into this disease is the best thing. So how to prevent this? The simple way is actually to wear a mask. Number one, don't go out of your house. So don't come in contact with any third person who might be a potential asymptomatic carrier. He might spread you. So you should look at every person as an asymptomatic carrier who might spread this infection to you. Second thing, and let us presume that you have to go out of the house. In such a scenario, you have to wear a mask. I'll tell you, some people say you don't have to wear a mask, but that is not true, because what happens, an asymptomatic carrier, if he is wearing a mask, the chance of he transferring this infection to another fellow who is not wearing a mask is around 25%. So, an asymptomatic individual who is wearing a mask, spreading it to another fellow who is wearing a mask is only 5%. You get it? That's the beauty. So, 2 to 5%. Okay. And asymptomatic person who's wearing a mask, spreading it to another person who's wearing a mask is 2 to 5%. I repeated that because that is a very important point. 2 to 5%. That's a very little chance of you acquiring this. And third thing is, when you go out of the house, you make sure that you wear a mask and wear a glove and wear proper footwear, so that you don't step on any of the secretions of the infected people and get it to your house, and you will get infected, and you will not infect your household as well. So that is the first thing. What is the second thing? So what happens is, suppose, let us say that you are infected with coronavirus and you have got mild symptoms. Let us say you have cough, you have simple fever, and you have simple these things, and you still don't have any breathing difficulty. Stay at home. You just be separated from your family. Stay quarantined. Drink a lot of fluids. Drink a lot of, have good food. If you are a diabetic, if you are a hypertensive, make sure that you take your medications correctly. Talk to your doctor on phone. Get your sugars under control. Check your blood pressure tablets and get under control. Do mild exercise. Rest and drink a lot of fluids. And watch yourself whether you become more symptomatic. If you become more symptomatic, go to a doctor. Presently, you're becoming more symptomatic is chance of you becoming more symptomatic is very less, because if you are a diabetic, if you're a hypertensive, yeah, you have a chance of becoming more symptomatic. But if it's under well control, and if you're a person who was having all these numbers under control, and you were doing good exercise and all those things, and your immunity was good all these days, your possibility of you going into that 15% is very less. So stay at home, take care of yourself. You will come out. You will definitely have to have faith in yourself and faith in everyone's words. Okay, so you will, they will absolutely become asymptomatic in a matter of 14 to 15 days. You can do a repeat swab, and swabs will be negative, and you can be comfortable, be at home. Now, the next thing is, if you have, let us say, a severe cough or breathing difficulty, fever, generalized weakness, you have to go to a doctor and they'll admit you. So let us see what options the doctor has to treat you. First of all, doctors, of course, they will give you a circulatory support, in the sense these people might develop drop in the pressure because they develop something called a sepsis, in the sense when some organ is involved, there's a release of a lot of toxins in the circulation, and these toxins, they cause something called vasodilatation, that dilate the vessels in the body. So because of this dilatation, vasodilatation, you can have a drop in the pressure. As I told you, there can be a reduced organ perfusion, all these things. To prevent the organ hypoperfusion, that is reduced perfusion, he will give you on some fluids, he'll give you on some inotropes, at the same time, inotropes, and they'll give you a circulatory support. Number one. Number two is, if you have breathing difficulty, they'll give you oxygen and they'll give you non-invasive BP support, so that your saturation in the blood is also maintained. Number three is, we have a few antiviral medications. Okay, they are called as broad spectrum antiviral medications. Because this is a novel virus, we don't have any specific virus for that. Okay, we have some antiviral medications that are broad spectrum, that were used for all the viruses. Something like oseltamivir. Okay, so what the doctor has, apart from the circulatory support, he has some antiviral medications. So we have these broad spectrum antiviral medications, something like oseltamivir, ritonavir, or leponavir, and these viruses are actually targeted against a lot of viruses. And see, ideally, what was the doctor doing? Initially, we never used these antiviral medications to treat any viruses, because viruses body used to develop its own immunity against these viruses. But this is a situation where many people are not putting up a response against this virus, and so we are trying to treat, and many people are going into uh, severe medical conditions because of the fact that they're not putting up an immune response. So we are supporting such people to come out by giving antiviral medications. We have some viruses like oseltamivir, we have viruses like lopinavir, ritonavir, and some IV infections like ganciclovir, IV antiviral medications like ganciclovir. All these are actually given, but they have shown some promising results, but they are not showing any definitive results. So what people tried were, they were giving some anti-HIV medications like remdesivir, and but these were not showing any good results. So another promising drug that was given to these patients were some anti-malarial medications. They called chloroquine, hydroxychloroquine. These, they had a very good safety profile, hydroxychloroquine and chloroquine. And these hydroxychloroquine and chloroquine, they add to the level of the lysosomes. This lysosome is a particle inside the nucleus of the cell that used to act at that level to prevent the internalization of the virus. Okay, so that gave a very promising result. But whenever we use these, there are some side effects as well, because these were used along with some antibacterial medications. They were causing something called as a prolonged QT interval, in the sense that causes abnormal rhythms in people, and people should die because of that. So that happened only when it was used along with antibacterial medications. So per se, hydroxychloroquine and chloroquine, they had very good safety profile, and they were giving very promising results in the particular situation. And third thing is, there is something called EIDD 2801 is another compound. EIDD 2801 is another compound that was showing very promising results against seasonal flu. So there's a lot of research happening in this particular compound. This compound can be a promising answer in the coming future, but presently no. So what happens? Presently no. So a lot of research is happening about this, and yeah, one day solid antiviral medications will come up, and that will help us in treating all these patients. And another promising treatment that happened was a plasma transmission. So when a person was infected with COVID-19, and when he had put up an immune response, you take plasma from these patients and infect into a very critically ill patient. So he was showing signs of improvement quickly because these antibodies were triggering further antibody production in his body, and he used to recover very quickly. But at the same time, the plasma transfusion has got its own side effects. So that has to be indicated, that has to be given to only patients in whom we don't have any other chances. Of course, in India, there's another research happening that you inject a negative ion along with plasma. So that was giving us more result. The negative ion was killing the bacteria directly. It was increasing the oxygenation of the blood and all those things. And that way patient was recovering very quickly. Of course, the research is happening in India as well. And it seems to be a very promising research. So let us wait. And third thing is, there are some researches happening to develop a vaccine against this. So let me speak about this vaccine a little later. So these are all the treatment modalities that is available in these severely ill patients. So what happens? Third thing is in a critically ill patient, treatment modalities. So same thing, we have these antiviral medications, we have antibacterial medications to prevent certain infection. We are giving circulatory support, like we are giving some medicines that improve the blood vessel, giving fluids that improves the blood vessel, and we are preventing the organ perfusion and all those things. And yeah, in these patients, we are giving him ventilatory support. That is very important. So we are giving them ventilator support to maintain the proper oxygenation of the body. So preventing him from going to respiratory failure. So when we have respiratory failure, we put him on ventilator support. See, this ventilator is an invasive support. Ventilation in the sense we put a endotracheal tube, a tube into the trachea and connect into a artificial lung. It's called as a respirator. The entire boom today in the market is we don't have adequate these ventilators to treat the number of patients what we have. So because of that, so what happened in Italy and all these things, they were choosing people who thought, whom the doctors thought will improve. And for them only respiratory support was given. The other patients respiratory support was not given because they thought anyway this patient will not survive. Let us leave him alone. So luckily such situations not happened till date in India, and we have adequate ventilators as of now. And some really companies are switching gears and they're making some low cost ventilators in India that can be used here in India and can be explored as well, and supporting our friendly nations also. So that's a total different discussion. But presently, we have not gone to such a situation where ventilators are a scarcity. So ventilator management. So what happens if when the person goes into ventilator management, we should have adequate medical personnel who know how to talk to a ventilator, how to set up a ventilator, and what ventilator setup can be given to each patient is the subject of analysis that an expert can give, and the number of experts in India are also very less. So so since we don't have adequate ventilators, we don't have adequate medical personnel who can talk to all these things. Another way of preventing all these things is quarantine. So what I would at this point of time tell everyone is to please stick to quarantine. That will prevent you from going into all this. So these are all the treatment modalities that is available. So the next thing will be what care we should take as I've told about all these things. So the another important point what I would like to add at this particular point is about our patients who are susceptible to this. For example, what was the class of the patient that were defined to be susceptible to coronavirus and who can have a bad mortality? So they are the patients, number one, who are elderly, who are above 65, and patients who are having long-standing diabetes, people who are having long-standing hypertension, people who have heart diseases, people who have renal diseases, and people who have liver diseases and all these things. So why? I think by now, since I have told you, most of the patients will be knowing why these people are susceptible. Because if you have uncontrolled diabetes, you have diabetes is a systemic disease. It can cause disease to brain, disease to eyes, disease to heart, disease to liver, kidney, and all this. So a person who's already having a pre-existing disease like this, if he gets coronavirus and if he goes into circulatory failure, so the person is already in a compromised state because of diabetes, and if he further compromises because of circulatory failure, his chances of mortality is very high. Number one. Number two, in elderly patients who is above 60, 65, their immune systems are not very good. They will not be able to put up a good immune response. So they are very susceptible. And children, of course, Children who are very young still and who are not able to put up a good response might die, but there is no much data that is available to tell about children and their mortality. It's not available still. So let us speak about pregnant women. So what happens in pregnant women? Pregnant women who underwent a cesarean section could not, pregnant women who were infected, their children were not found to have this coronavirus. Okay, but there was no studies about people who gave a vaginal delivery, who gave a normal delivery. It was not, nothing could be done, told about this. So we don't know as of now. So, but pregnant women who were underwent a cesarean section could not transmit it to their children, and the children didn't have. So, placental transmission of coronavirus is not seen. So you can be rest assured about all those things. So, ladies and gentlemen, today we have spoken so many things about how the virus came into existence, how it spread among the Chinese population, how it spread to other countries, and as we have seen in newspaper, many countries took a lot of travel bans and a lot of quarantines and social distancing and all those things in preventing from virus spreading in their population, and we have also done that. And third thing is we have seen how the virus gets into the organ of the body, how will it cause disease, and what are all the things that happens, and what are the options available for a doctor to treat all these things, and how the patient comes out of all these things, and he should have a good immunity to come out of all these things. We've spoken so many things about this. So, ladies and gentlemen, to wind up the entire discussion, what I would like to tell you is, number one, please refrain yourself from going out of the house, because as I told you, you have to consider every other person as a potential asymptomatic carrier who can infect you, and it's not a rule that you are going to be asymptomatic like him, and it's very much possible that you can become severely sick or critically ill and on a ventilator, and you can spread this to your people. So please refrain from going out of the house. Number two, even if you have to go out of the house, please make sure you have a good personal protection equipment. That is, you have a good mask, you have a pair of gloves as much as possible, and wear good footwear. That is very important. Third thing is, once you come out of the house, you make sure that you wash your hands or take a good bath and drink a lot of hot water, so that if at all the possibility of you clearing out that viral load from the throat happens, let it happen, nothing to lose. And third thing, especially in diabetics and hypertensives, please talk to your doctor, take your diabetic medications in time, maintain your sugars well below 200 or 160 postprandial and 120 fasting, and make sure that do a good part of your exercise. If you are not able to go out of the house because of this quarantine, you're not able to take a regular walk in the park or go to a gym, please do some yoga at home, meditation, and some stretching exercises with your family, and please have a quality family time. Please maintain a good numbers of your sugars and good numbers in your hypertension, and people who have any other disease or already pre-existing disease, please take additional care so that you don't get infections from this coronavirus, and please maintain good social distancing and take all the precautions that has been told by the government. And if you have developed any such symptoms, please talk to any medical professional. So I am Dr. Bangaru Girish. I'm an interventional cardiologist. And if you want to have any of the further questions, you can contact me on the below given email address and telephone. And wish you all the luck. Please take care of yourself and be safe. Thank you very much. Thank you.